So folks, thank you so much for being here. I'm really looking forward to our time together in this learning community. And my hope is that it truly will be a learning community conversation about this particular topic, which again is Clinical Foundations of Clinical Supervision, Part 2. You did Part 1, 14 hours online. Congratulations. It's an accomplishment. That's great. So thank you for completing that, and thank you for being here. I'm going to share my screen. We'll take care of a couple of logistical things. And again, what I've asked everybody to think about at this point is let yourself kind of go back to that 14-hour online training. And we'll have a little bit of a conversation about that. Okay? So let's take care of a couple of logistics. If you have not done so already, and Kristen is the last person who did so, if you have not yet done so, please do type your full name into the chat feature right now. I just want to make sure that there's a stamp, kind of an official chat timestamp that everybody is here and that we are all beginning. Wonderful. Thank you, Dr. Holly. Excellent. All right, so I'm going to share my screen. So here we are, Clinical Supervision Foundations II. My name is Paul Warren. I'm really glad and appreciative to have the opportunity to be in this learning community with all of you today, and 3 more times to talk about this particular topic, to explore this particular topic, to dig a bit more deeply into this particular topic. I'm currently a research project director at the New York State Psychiatric Institute. I'm also a senior staff trainer and a curriculum writer for the Northeast and Caribbean Addiction Technology Transfer Center. And you did hear that correct. Northeast and Caribbean addiction technology. Juan's like, yep. And Juan, you're absolutely right. That does mean that there have been times when I've been forced to go to Puerto Rico, St. Thomas, and St. Croix to train. Tricia, do not worry. It hasn't been for a really long time that I've been. Yeah, it's torture. I know, but I did it. I did it. So folks, I have not gone to Puerto Rico, St. Thomas, or St. Croix for a very long time. And I'm delighted to have the opportunity to be here with you today, instead of Puerto Rico, to be talking about this particular topic. I also have the great opportunity to be a member of the Motivational Interviewing Network of Trainers, an organization named MINT, which is motivational interviewing, as you may know, is an evidence-based practice. And it is an evidence-based practice that focuses on and helps people to identify their motivations to want to make a particular behavioral change. And then we engage in a conversation that supports strengthening their motivations and helping them to determine how to achieve that particular goal. I'm also happy to report that in the middle of October, I will be going to Copenhagen in Denmark to deliver a workshop. It's only an hour and a half, but I'll be delivering a workshop around motivational interviewing at the MINT conference, which is an international conference that happens once a year with people practicing motivational interviewing all over the globe. So hopefully I will see you all again after that at some point, and I can tell you how it went. Today is part 1 of our 4 parts in 3 hours each, focus on clinical supervision. And for extra credit, if you know when part 2, our next 3-hour session is, if you know the date of when that session is, type it into the chat. That's just for extra credit. Don't stress yourself if you don't know, but if you know, type it into the chat. Excellent. And for extra credit, what time does it start on the 18th and what time does it end? Excellent. Fantastic. Thanks for the reminder. I appreciate it. Sometimes I don't always remember what's next on my calendar. I appreciate the reminder. Folks, I said several times already, but this is a learning community conversation. You're here because you have done the prerequisite work necessary in order to participate in this conversation and be part of this learning community conversation. My hope is that the time we have together, this 12 hours that we have together, 3 today, 3 more on the 18th, this 12 hours that we have together is going to be relevant and supportive of your work. Yes, it'll check a box. You will be able to say you completed this particular course. That's fantastic. You will get credit for completing that course. And my hope is that it will be practical and useful to you in your journey, and I'm choosing that word very specifically, in regard to your journey as a clinical supervisor. So to that end, what we talk about here, the information that I share with you, the information you share with each other, the opinions you raise and reflect, which are all welcome within the context of this learning environment, may not necessarily reflect the official views of our funder. And that's perfectly okay, because this is our learning community. It's supposed to be a relevant experience for you. So if what we talk about doesn't necessarily reflect their views, that's okay. As we talk to each other in this learning community, as we engage with each other, just asking everybody to be intentional and thoughtful about the language that you use, the words that you use. Words do have power, and we want to be using language that actually puts people first. So just keeping that in mind as one of our overarching guidelines that we'll establish here and will carry forward into any of the time that we're together. We want to be using language that is welcoming, inclusive, respectful, and affirming. The last thing that I would just ask everybody to consider is that as we engage in this learning community conversation, if you would please make I statements as opposed to every clinical supervisor who does this. So you don't have to be the voice for clinical supervision. You can be the voice for you. So I will do my best to make I statements as well. I don't know if I mentioned this. I'm a social worker by training. So I'm going to hopefully avoid saying, well, every social worker who does this. So I will try and model the guidelines I'm asking us all to abide by. So I'm going to advance the slide, but before I do that, I'm going to just take the screen down for a minute. And I'm just going to ask, I see a lot of people put 12 to 3 in the chat. Fantastic. You're all very quick on the chat, which is great. So what I'm going to ask is if you could wave, nod, or throw money just to let me know that Juan's like, throw money? I'm not throwing money anywhere. But if you could wave, nod, or throw money to confirm that you will abide by those particular guidelines as we interact with each other. And you can give a thumbs up. Thank you, Dr. Holly. Excellent. Good. I see nobody is throwing money, Juan. Thanks a lot. It's funny. I'll tell you just a brief story. One time I was in a person-to-person training, and I said the same thing about the guidelines, wave, nod, throw money, and whatever. Somebody in the training room did throw money. Exactly. And it was amazing because I caught it with my hand. And they were very impressed. They were like, wow, this guy has really good reflexes. And I opened my hand, and if you would care to take a guess, how much money do you think it was that I actually caught? Feel free to write it in the chat if you'd like to guess. Excellent. Understood, Juan. Understood. Juan's like $1. Brittany, $1. No, folks, it was 1 red cent. It was a penny, but it's okay. I caught it, Oh, Eunice, I like the way you think. Eunice is like $100. No, Eunice, it was a penny, but it was a lucky penny, and I carried it for a very 1 cent richer. Exactly. I did carry it for a long time. And it was a particularly fun training as well. So, folks, I'm going to share my screen again and just review a couple of our learning objectives. And one, and I said this earlier, and I want to really underline it again, it really is an opportunity, hopefully, for us to get to know each other a little bit. That you will get to know each other a little bit as you interact with each other. Also, identifying sort of personal expectations that you may have about this particular training. Also, we're going to talk about the course assumptions. There are assumptions that this course is actually based on. And we will also be going over the agenda for the workshop. So those are some of the things that we're going to hopefully try and accomplish in our less than 3 hours remaining today. Now, if you look here, this was the kind of outline of part 1, the 14-hour online Zoom course. And you'll see that all these different bulleted areas were covered in that. And I'm sure you're thinking, oh, yes, I remember modalities, methods, and techniques. I'm sure. Exactly. I love the smiles on some of your faces in regard to that. And that's understandable. So what I'm going to do is I'm going to stop sharing my screen for a minute. And I'm just going to ask, is there someone who would be willing to unmute, share your first name, and we'll see who's quick on the draw for unmuting, but unmute, share your first name, and just share with us one thing that stood out to you about your experience of the 14-hour course. There's no right or wrong here. It's just something that stood out to you, or something that maybe you have a question about, or something that you reflected on. So I'm going to stop talking and allow whoever wants to unmute. Please share your first name and then just share with us one thing that stood out to you about the 14-hour course. The floor is open. Kristen, you're very fast on the unmute draw. Go right ahead.
Hi, I'm Kristen. I just liked how well organized it was and made it so because it's obviously time consuming, but it made it easy to use. So that was what I enjoyed about, because I've done courses like that before, and it was like I would skip over something and then I'd have to go back and redo everything. So I liked how organized it was and easy to use.
Okay. Organized, user-friendly.
Mm-hmm.
Time consuming, but
yes.
you were able to navigate it in a way that actually worked for you.
Yes.
Okay. Kristen, thanks so much for starting this off. Who else? Again, there's no right or wrong here. By the way, and Kristen, I'm glad to know that you had a good experience. I will just say in full disclosure, I did not create that course. I have taken it. I had to submit my certificate when I did this many, many, many years ago. So I've taken the course. And so whatever your thoughts, questions, or reactions are, and again, I'm not asking you to necessarily, critique the structure of the course. I'm asking you as a supervisor, as a clinical supervisor, and as a person who completed it, Lourdes, go ahead. I see that you're unmuted. Go ahead,
Yes.
please.
Hi.
Hi.
I think that the course is very structured. I like the way, because I'm a structured person, it's easy to follow the way. From the beginning up to the end of the evaluation, the outcomes. And I believe it's very helpful for a supervisor. I'm not a supervisor yet, just self-disclosure. But I've seen it more than ever to the supervisor that's supervising me. Okay, this is now, you don't like this, but I'm not talking about how I feel when they supervise me. With this course, it's kind of clarified everything. Oh, so is that the way it should be? Those kind of stuff. So, okay, I don't want to take the space too much. Thank you.
Thank you. And I want to make an observation here. And again, whoever else is thinking of unmuting and putting something else on the table, please do. But I want to say, Kristen identified early on, I like the organization of the course. Lourdes, you just said, you're a structured person. You like the structure of the course, and the course made you think like, oh, this is what supervision is supposed to be like. And maybe what I'm experiencing is not.
Yeah.
Did I get that right?
Yes, absolutely. My point is taken so well. Thank you.
Okay, fantastic. So,
good morning.
Go ahead, Deborah. Go right ahead. Good morning.
Yes. Also, the course was very, was very structured. It was so structured for me to the point that I had to call in and ask them because I got to a point where I couldn't move forward. And so I called in and asked them, hey, what am I doing wrong? I'm in forward. So then she did something and took me back to the beginning. And one of the slides was missing. So I literally had to go back and start all over, not because of me, because something was wrong with their slides.
Oh,
but
no.
it was time consuming, but it was really structured. I mean, it was really good.
Okay, so Deborah, did you get like a consulting fee for debugging it or anything?
No, but I was glad that it was a way that they gave a contact where you can actually call and ask for help.
Yes.
So that's what I enjoyed. It's like, okay, I'm stuck. What do I do? And then they provided, okay, well, you can call and ask for help, and someone was there to actually guide you through it. So that's the organizational part of it is that I did like.
Fantastic. Thank you so much, Deborah. And I'm really glad to hear because you're one of the first persons whom I've ever heard like identify helping to debug their slide problem. I'm very happy to learn that they were responsive and you actually benefited from the interaction. I'm not surprised, honestly, and I'm very glad to hear it played out that way. Yeah, Heather, since you're unmuted, could I ask you a question?
Sure.
So I know you're kind of multitasking here at the moment, but I'm wondering, since we can hear you, I can see you, by the way, too, and I think everybody else can too.
Perfect.
Yeah, but I'm wondering, what was your take on the 14-hour course?
I did mine in sections, which helped me. Like I would do, the first section, the first, one day, and then like a week later, I would come back to the other ones.
Wow.
I thought it was organized well, but it was like a ton of information, which I know we need, but it's kind of hard to process. So, I mean, I still have everything referenced. I just haven't used any reference back to it. So like when you were asking us to look in the beginning, I was like, oh yeah, I forgot about that. Oh yeah, I should look at that more. So they organized it well, but it was still a lot in a short amount of time.
Yeah, and Heather, thanks for saying that, because this course, because we have 12 hours together, which is 2 hours less than that. This course is packed full of information similarly. And Heather, you're really identifying a great strategy, which is allow yourself to be exposed to it at the pace that you can kind of take it in, put, a mark where, maybe that's something I'll go back to and revisit at another time, and trust your instincts about that, and realize that it's not going to be possible to digest or take all of this in over this 12-hour period either. So I appreciate you sharing that strategy, Heather. Yeah. Go ahead, Brittany. I see your hand is raised. Go ahead.
Hi, I was just going to say, kind of adding on to what everybody's been saying about the organization and taking things at your own pace is that what I really liked about it was there was a section on like time management. And I loved like the whole thing so much, like, because there was so much information. I like printed it all out. So because it was so much that I was like, I'm gonna forget something, and also wanting something to reference.
Yep.
But yeah, I really loved how it pointed out, you know, like there's some things that are like immediate but not urgent, and you know, urgent but not important, and like to what to delegate and what, you know, to do yourself. So like that time management, because in the supervisory position, depending on where you work, you know, you probably have a lot of different roles. Like at my organization, I'm not a supervisor currently. Part of it is you need this, you know, to move up. But
Right.
yeah.
Got it.
But there's multiple roles, you know, and so that requires a lot of time management tasks in
Yep.
order to be able to prioritize and get everything done that you need to get done. So I really liked that.
Mhm. And the way the online course laid out the prioritization
Mhm.
and the way you kind of manage your time spoke to you.
Yes.
Fantastic. Fantastic. Alexine, am I pronouncing that correctly?
Yes, you are.
Fantastic. That Trisha, one. I'll tell you maybe at the end how I messed up Trisha's name, but only with Trisha's permission. Alexine, what was your take on the 14-hour course?
The resources were amazing, and
Mhm.
especially the technical assistant publications and all the other resources. And then at the end of the course, there's this list of all of the resources that you shared in a whole list, so I could go, instead of just looking at each module, the whole comprehensive list was there, and I found that to be very helpful. So
Yeah.
I really appreciated that.
Fantastic. And you know, as you describe it, that 14-hour course turns into like a 28-hour course, because you know, you could do a module, and then you could look at a resource, and then you could go back to the so excellent. And you like those resources.
Very much so.
And is there one that stood out to you that you might recommend to people in the learning community? One that you found particularly interesting, or one you're very curious about?
It was the tip 21A, 821. I found that to be a valuable resource.
Uh-huh. Mm-hmm. Yeah, tip 21A, yes. And I'm wondering, did anyone get it? If you got a chance to look at tip 21A, or you're curious about it, just type 21A. Yeah, and look at that. Zachary's giving us like a visual aid of it. Excellent. Yes, type 21A in the chat. And if you haven't had a chance to look at it yet, just type NY, not yet. And Alexine, before I saw that you've remuted, and maybe we can ask Zach too, Zachary. You'll let me know if Zach is if which you prefer. But Alexine, can you say a little bit about why tip 21A was particularly of interest to you?
I think it laid out a lot of the approach to clinical supervision. It
Yes.
gave a lot of examples.
Yes.
It went into more detail, even from what was presented in the modules and the slides.
Yep.
It was very comprehensive. So I found that one, and then the other was the TAP 52.
Uh-huh.
The other one that was really, really good. So I just bookmarked it on my bookmark bar so I can easily have access to it.
Fantastic. Fantastic. Thank you so much. And Zachary, is there anything you would add to what Alexine has said about
Well, if I'm being
21A?
honest, I would probably, so I printed it out, but I would probably have entered an NY, in the,
Not yet, right?
I printed it out and kind of like flipped through it a little bit.
Yep, 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 yep. And I'm typing something in the chat right now, and I'm curious, Zachary, if you and Alexine would agree with this about 21A. And I know you've just flipped through it, but and anyone else who's familiar with it, but really it's kind of a how-to in terms of clinical supervision from the supervisor's perspective. Yeah. So I'm wondering, did anybody get to take a look at or sort of underline TAP 21? Yeah. Brittany, what was your reaction to TAP 21?
I actually brought it to supervision and asked why we don't use something like that, here, because I thought it was very helpful. And like, I really like clear, I guess, guidelines on, what is the correct way or what you need to work on. And I thought that was a really clear way of knowing if you use that.
Mm-hmm. Fantastic. Go ahead, Lourdes. Yeah.
Yeah, I'm looking at it right now, and kind of is because there's a lot of them, right? So when you come to this kind of situation, you have to review what it is. This is very important. The way of this is the rating. It is the rating form, the competency rating. That's why I'm reading a competency rating form, top 21A foundation areas. So what I'm seeing here is this is really important because now we see how do we gonna rate this. But I'm just kind of wondering, is this in a supervisors? Is this for the supervisors? Are we rating the supervisors or the supervisor rating us? I just have to ask you, but
yeah.
Is this
so let's be very clear. And I'm going to start broad and then I'm going to get specific. And Lourdes, I love your question because TAP 21A, TAP 21, all these resources. And again, I'm thinking about like overwhelm.
Yeah.
And how to use them, what to take from them. And I want to start broad and I want to say, consider, folks, these are tools. These are tools. They're tools that will help you. And I like what Brittany said. They'll help you to be specific. They'll help you to be clear. And they'll help you to be consistent. They're tools. Okay? My hope is that during our 12 hours together, you will start to become familiar with these tools. You'll have your whole career to continue to become familiar with them as a supervisor and how to continue to use them as supervisors if you already are supervisors. And you may already be using them. Is anyone using TAP 21 as a guide to craft professional development plans? Yeah? Juliana, you're using it? Okay. Okay. Is anybody else using it? No? Okay. So Juliana, would you say a little bit about it? If you're okay with that?
Sure. Well, I've just really started. So
Fantastic.
I've been trying to brush up on supervision because I've been out of practice for a few years and I've been consulting, and so I have a brand new limited license alcohol and drug counselor trainee who I'm used to doing mental health clinical supervision, and so I'm trying to really
get the scope of service to be really specific for this individual. And so that's just something that basically I gave him a copy of the TAP 21 and I said, you know, this is sort of a career development tool.
Mhm,
There are like 126 competencies or something like that, which
mhm,
is
mhm,
really overwhelming. But I also like the way that it is sort of chronological, right? And so the first section of competencies is really basic substance abuse knowledge. You should know something about addiction. You should know something about alcohol in the body. You know, these are things that he's not being thrown deep end into somebody with a co-occurring disorder. This
mhm.
is like, you should be able to teach a group on how cocaine affects the body or what, you know. So I really like the way that it sort of allows new clinicians to kind of wade in toes first in terms of get your understanding, get your knowledge, start some basic, you know, unconditional regard kinds of skills, basic
Yep.
therapy skills.
Yep.
And so it's really just helped me kind of make sure that I'm focusing on things that are appropriate for his level of licensure, rather
Mhm.
than, you know, I've been doing trauma therapy for years. And so I'm like, can't do that. Gotta stay focused for
Right.
him, right?
It's not developmentally appropriate
Right.
because you're determining where the worker, the counselor is in terms of their professional development.
Yep.
Right. So Juliana, I'm going to ask you to elaborate in just a minute, but I want to make a statement because I want to bring it back to what Lourdes said to us before. And keep in mind, broad tools, okay? TAP 21, what Juliana is referring to, is a tool that supervisors use to assess the competencies of their supervisees. So it's the tool that you're actually going to use as part of the work that we're going to do in this learning community conversation, because you are going to develop in the assignment that you'll have that will complete your participation in this training is you will develop a professional development plan for a supervisee using TAP 21 as the guide. So you in the role of supervisor, like Juliana has just described so specifically and so realistically, making an I statement following our guidelines, you will use that tool, TAP 21, to help frame what competencies you're going to focus on for developing that supervisee's capacities. And I'm going back to what Brittany said earlier. It's so you can be specific, so you can be clear. The beauty of the tool is it defines the capacity. And Juliana, tell me if you agree, if I'm portraying this accurately. It defines the capacity, and then it helps you. No, we're talking about TAP 21, not 21A. And I'll get to 21A in a minute, but we're talking about TAP 21. Okay. And again, I know it's confusing, so I want to be very deliberate and clear so that we're all on the same page about it. TAP 21, it lists out the capacities, it describes the capacity, and then it describes what constitutes reaching the capacity. Juliana, is that fair? Is there anything you would add to that or anything you would clarify?
I would say that it's a little bit more ambiguous than I would like. Right, as it does talk about what it means, what each competency, what you're sort of looking for, but there's no sort of rating scale laid out for you.
Right.
I mean, you have to use your clinical judgment, obviously.
That's right. Yep.
To be able to say, I think you're struggling with this unconditional positive regard. I think you really need some more motivational interviewing training or whatever.
Yep.
It's not like there's not a rubric to evaluate people.
Yeah. Well, actually, there is a rubric, but we'll get to that later.
Okay.
Lourdes, you wanted to say something, and then we're going to go to Dr. Holly.
No,
Go ahead.
Just quickly, because I'm
Please,
trying
go
to
ahead.
in line with the conversation with Juliana said that there's not, is it now another question, the top 21A, is this the rating of the competencies that we're going to use? Because I've seen
No, we're going to use TAP 21 is what we're going to use to develop the professional development plan. TAP 21A are the capacities of a clinical supervisor.
Wait, let me.
And that's a different focus.
Okay, excuse me. I have it in front of me. Competency rating form, TAP 21A, foundation areas. And that's what I'm seeing the ratings.
Yes, but that's for the supervisor.
Okay. Oh.
As the supervisor, you're going to be using, right. And Juliana just typed it in the chat. Tab 21A is for the supervisor, and 21 is for the worker, the clinician.
Oh.
So as Lourdes, thank you. I'm glad you're asking for clarification, because we all need to be on the same page about this. So we, in our role as supervisors, evaluating the work of our supervisees, developing professional development plans for our supervisees, would use TAP 21. If we're looking at capacities of a supervisor, we are talking about TAP 21A. Okay? So that's, you don't need to get any deeper than that today. Go ahead, Dr. Holly. The floor is yours. Thank you.
First of all, thank you. I'm glad to be here from Philly. So someone had just mentioned about it not being a rubric. I come from a very person-centered approach, whether I'm seeing a client or a supervisee. And so for me, I look at that approach as my rubric, as my guide. So I know, and I can see when I go into a group session or individual session, right, what the supervisee, meaning they would possibly need to work on. But at the same time, I look for what they also are saying, okay, these are my strengths. These are areas I need to improve on. And so those are some of the things I use as my rubric, as my guide when we're coming up with this plan together, even though we have this supervisor title and placement and role. I just try to make it collaborative as possible to have that buy-in. But but that's just my approach as a supervisor. And so I think for me, that has been a serving rubric, if you will, like what I see visually, what I observe within their sessions, or it could even just be their paperwork. It could be something administrative, and then what they bring in too.
Yes.
Thanks.
Yes. Thank you, Dr. Holly. And you know, there are a couple of things I want to underline in terms of what Dr. Holly said, because Dr. Holly has just brought the learning community like 10 steps forward. And 10 is a conservative assessment. And the reason I'm saying that is because Dr. Holly, what you identified and identified so beautifully in an I statement sort of way, is you're sharing your personal model of supervision. You're sharing the things that influence you as to what you're basing how you interact with this person on. You framed that your work is very client-centered. You laid out very specifically, I trust direct observation, either of paperwork, of their practice, or whatever. And because I'm choosing a person-centered perspective, because I'm collaborating with the person, I'm also asking them to participate in it and identify their strengths, their growth opportunities. And the professional development plan springs from that collaboration. And again, I love, and Dr. Holly, please confirm that we've not met before this community conversation, nor have I paid you to say what you said. Excellent. So what Dr.
No,
Holly,
we are perfect strangers. No, I'm probably the
excellent.
only person on here from Philadelphia or another state, unless it's
Okay.
Jersey, but no.
Okay. All right. Excellent. Thank you. I just want to be very transparent because Dr. Holly, in addition to demonstrating our guidelines beautifully, is also, again, advanced us as a learning community into what we all have the opportunity to be thinking about, our personal model of clinical supervision. And again, I want to connect it to what Brittany said. We want to be able to be consistent. We want to be able to be clear in what we're looking at and understanding what we're looking at. And we can also choose a client-centered informed perspective in order to invite the supervisee to be part of that conversation and to be part of the development of the professional development plan. Okay? So let me just quickly recap two things. Thing one, as per Lourdes's excellent questions and sort of reflection, TAP 21 is the tool of the supervisor as they evaluate the competencies and build the professional development plan for their supervisees. TAP 21. In our learning community, as we work together today and for the other times that we're together, everybody has to have access to TAP 21. So if you have access to TAP 21 now, either you printed it out or you have access to it electronically right now. If you have access to it right now, type a Y in the chat. And if you don't have access to it yet, just type NY, not yet. Because what I'm going to ask you to do by the time we meet next time, is to get access to it. No problem, Eunice. No problem, Deborah. Just get it as soon as you can get it. Okay. And we can even make sure that it gets sent out to you so that everybody has access to it. And you don't need to print it out. You can have it electronically if that works for you. Okay. I have it electronically on my desktop, so I have access to it that way. Okay. Excellent. Oh, Tree, thank you so much. Our colleague Tree Chapel just put the link in the chat for that document. Okay. So everybody's going to need that. So please make sure you have access to that for next time. Okay. The other thing that I want to underline, and again, I'm just recapping, is that we are everyone in the learning community is going to, as part of your final work for this course, is you are going to develop a professional development plan for a supervisee. It can be a real supervisee, or it can be a made-up supervisee. If it can be real because you have a supervisee or you can draw from a supervisee in the past, that's best. But if it can't be a real supervisee, I think we have a scenario that we can share with you, and you can develop a professional development plan using that scenario. Okay? But everybody is going to be responsible for developing and submitting a professional development plan. And excellent. Wonderful, Eunice. Fantastic. Good job. Eunice just downloaded it. That's great. And Tree, thank you again for putting the link in the chat. So folks, everyone is going to develop a professional development plan. Now, brace for this, and please remember what I'm about to say here. You are not officially complete in this course until you have submitted the professional development plan and I have reviewed it and okayed it. Once I get it, I will review it. And if it reaches the bar of what is an acceptable submitted plan, then you are complete and your credit will be issued for this course. Do not worry if you hear from me and I say, hey, I just need to check in with you about your professional development plan. It needs this particular area, it needs this particular area, or it needs this particular area. Don't worry if I do that. That happens quite frequently. And I'm confident, though. I think we're setting a good foundation. And it may not happen, but if it does, that's perfectly okay. That's part of the process. We're working together. So I may give you some feedback and ask you to revise it and then resubmit it. But again, once it's reviewed and approved, then your credit is issued for the course. Okay? What I want to let you know, and I think you know this, but I just need to repeat it, is that we cannot give partial credit for this course. And you're not completed with the course until you get an approved, until I review and approve your professional development plan. Dr. Holly, please, the floor is yours.
So the professional development plan is like our capstone, pretty much. So we show up, we
Pretty
work
much.
together. Okay, and that, okay. All right,
Yep,
thank you.
pretty much.
That makes
Pretty
sense.
much.
Okay.
Yeah. Yeah. And the other thing that I'll say in regard to that is, as you're working on your professional development plan for this supervisee, because remember, you're in the role of supervisor. You're developing this professional development plan for the supervisee. As you're doing this, if you have questions, if you're not sure, if you need help, that's what I'm here for. Okay? That's what I'm here for. So you shouldn't hesitate to reach out to me if you need help with going through the professional development plan. Okay? Now, I don't want, yeah, go ahead, Lourdes, please.
A lot of questions.
That's great.
So, with this professional development plan,
Yes.
I just forgot if I read something. As an example, I've read a lot of MI talking there.
Yeah.
But do we have here? I just, as I said, it's overwhelming to me sometimes. I'm going back. Do we have an example of this in the course, in the structure?
What I'm going to actually show you, and you prompt me to do this, Lourdes, is I'm actually going to show you the form you're going to fill out, and we'll walk through it. But thank you, Tricia. Thanks for letting me know. The thing I want to remind you of, though, folks, is TAP 21. I'm going to repeat this again. TAP 21 is going to be the tool that you will use that will help you complete the professional development plan. Okay?
Thank you.
Yeah, you're welcome. You're welcome. And I'm going to repeat that many times during our time together, but TAP 21 is going to be the tool that will help you to complete that professional development plan. Now, having said that, I'm going to show you the professional development plan, and we'll just look at it together. We'll just walk through it a little bit, and then we'll just set it aside because we have other things to focus on today. But I wanted to let you know what you're responsible for in terms of completing the course so that you have a heads up right now, and that you can be thinking as we're engaging in this conversation, everything that we talk about is culminating and coming together in what you're going to do in the professional development plan. So it's the ability to use TAP 21 to develop a professional development plan that helps this supervisee achieve a specific goal or goals. Okay? So I know it's a little bit of cart before the horse because there are broader things we need to talk about. And to that point, I want to go back to what Dr. Holly told us about sort of a personal model of supervision, meaning that these are the influences that help shape the way I provide supervision. And we're going to talk about that. But I also want to be concrete and specific. And it's funny because Dr. Holly and Brittany are next to each other on my screen together. So the idea of being able to be very specific and clear and organized with a professional development plan. Because keep in mind, folks, the professional development plan is for you as the supervisor, and it's also for the supervisee. It's for both of you. It's not just for the supervisee. So it's not just an exercise. It's also for you. It's for you to be clear and specific and precise about the supervision, the plan that you're guiding this person with. Now, before I show you the form, and I promise I'm going to show it to you, before I show you the form, I just want to open it up, and maybe we can hear from a couple of people that we haven't heard from, and we can certainly hear from people we have heard from, but I want to invite everybody to be part of the conversation. Let's just start off. What is a professional development plan? What's your take on what a professional development plan is? What is it? So, floor's open. Who wants to throw something out onto the table about what a professional development plan actually is? And also, go ahead. Go ahead, Deborah.
Well, just you saying it, I would think a professional development plan would be something I developed to put just to take different steps to help my supervisee move forward. We're talking about dealing with their learning experiences. So I think I would work with them on some of their learning experiences in the past. What kind of support I think I would ask them what kind of support are they looking for?
Okay. Okay.
And what do they see as a role model? I don't know. I think, and I would have to brainstorm it, but just some of them questions, I would just put it together and sit and talk with them first to find out what are they looking forward to get out of it. Right. And then I'll just, it's just like when I'm doing counseling with one of my clients, it's, asking them different questions in order to move forward. I got to be able to fill them out a little bit, know what they're looking for, some of the things they has experienced before. And so I think and for me, then I'll get an idea of what level where to start with them.
Fantastic.
You don't want to start too high. You don't want to start too low, but I just want to try to meet them where they're at.
Understood.
As far as
very similar to what Juliana said earlier.
Right.
Yeah. And Deborah, before we go to Charles and to Juan, Deborah, there's something you said that I want to link to what Dr. Holly said earlier. And when Dr. Holly said it, a light bulb went off in my head. But then I was so blinded by everything else that Dr. Holly said, that light bulb went out. But you just made the light bulb come back on, which is you both drew a parallel between what the work the worker is doing with the client and the work the supervisor is doing with the supervisee.
Right.
And keep in mind, folks, it's a different relationship. It's a different relationship with the supervisee. They're not your patient. They're not your client. You don't want to be going down that road. And there is a parallel process. There is a parallel process. And I'm going to go so far out on a limb as to also say that how you interact with your supervisees, how you provide supervision is going to have a direct impact on how your supervisees interact with their patients or their clients? And I see a few heads, maybe more than a few heads nodding. And we're going to come back to that. I don't want to lose sight of that, but I'm going to repeat that one more time, and then we're going to go to Charles. That how you provide supervision to your supervisees, the manner, the style in which you provide supervision to your supervisees has the potential to have a direct impact on how your supervisees interact with their clients. And Dr. Holly and Deborah, please remind me before the end of today, before we conclude at 3, please remind me, and I'm asking you to hold me to this, please remind me to come back to that point. So if it starts to get like late and I haven't gone back to that point, say, Paul, time to go back to that point. Okay? Charles, thank you so much for your patience. Floor is yours. And then we're going to go to Juan.
I think you just took a lot of stuff I was going to say. So
sorry about
that. No, I see the professional development plan is an actionable plan which has clear objectives and goals, measurable, that the supervisor in collaboration with the supervisor can help their supervisee professional development. And I think that has a vicarious impact as well, a parallel impact on the client, because as I improve professionally in my skills and my competencies, I also applying that with my clients that I'm dealing with.
Yeah, absolutely, Charles. Thank you. Thank you. And again, I want to underline something that Charles said before we go to Juan, which is that the professional development plan has clear goals and they're measurable goals. Go ahead, Juan.
Hi, Charles kind of took everything I'm just gonna say. It's clear guidance on what to expect when you go into your clinical supervision. So you know what needs to be addressed, and it keeps the supervisee and also the supervisor in line as to, okay, what has to be addressed, what we're going to address, and what is to look forward to. And it's also measurable.
Absolutely. And you know, there's so much that you said, Juan, and there's so much that I could underline, but I love in particular the way you said it. It keeps both the supervisor and the supervisee in line so that there's a focus, there's a direction. It's measurable. Fantastic. Fantastic. Anything else anybody wants to put on the table? Eunice, any thoughts about what the professional development plan is?
I just want to say that I totally appreciate this, because at one time, I used to be scared of my supervisor, and I didn't think that I actually had a voice. So after going over the training and learning about the parallel process, along with, you know, the authority part of it, I think it's about the authority, the power and control. And I learned that I don't have to just do what's told. You know, I have a voice in it. So that's what really stood out for me. And that's really what's important. So as you speak on like us having, me being a supervisor, I want to be able to give that to my supervisee, wherein they do have a voice and we're developing this together. It's not something that I'm putting together. It's a matter of we're doing this together in order to allow the company or allow the person to grow along with myself too. So that's how I look at it. That's what I want to say.
Fantastic. Yeah, Lourdes, hold your thought for just 1 second. I think Ruby wanted to say something, and then we'll come to you. Go ahead, Ruby.
Hi, everybody. I just also want to talk about the professional development also with the struggles. as a newcomer in the counseling field, also giving them guidance and also skills, that they can develop and enhance, and finding out what the struggles are. Right. To me, that also makes them a better counselor too, once they get in the right direction and understanding, about the struggles and to enhance their skills.
Fantastic.
So I agree with everything that everybody said. I truly agree with it. But I thought about that too, because I've seen that before, with some counselors struggling and feel that they can't do it and they don't understand it, so that was my take on that.
Thank you. Thanks so much, Ruby. Lourdes, the floor is yours.
Okay, sure. Quickly, I agree so much with Ruby, because what I've been thinking here, kind of a practicality sense, it's kind of a, I'm putting in a way of treatment planning. Like when you have this goal, as you said, the SMART goal.
Yes.
But you, as a supervisor, I'm just putting it as a patient and patient and client, and whatever you are, clinician, whatever you are, counselor.
Yep.
You can't make anything by your own thing. You have to assess, you have to understand. So that's what I'm putting this, if it is probably at that level or whatever you say it, it's a treatment plan. We should know first what is the problem, because it's kind of how would we know what one of my thing I'm working, of course, and she's trying to find out why the kids is not going to school. But when I ask, because it's, did you ask anything? What is the problem? He's smoking marijuana. We didn't talk about it. But it's kind of how do we solve a problem? We don't know the problem. Right. Now, so I mean, with this, I feel we put this in the context of supervisory, supervisee, and supervisor. We still have to know where is she struggling, and then based on what she told us or whatever we feel also as a strength, as doctor said, we can gauge it through that way, the strength perspective. Yeah. So we can put it in. I mean, I don't know. I just put it in that way to understand it.
Understood. And it's great that you're talking through it to sort of get a deeper understanding of it. And you're making a really strong connection, a parallel. I'll add one thing to it and tell me what your thought is about this, Lourdes, is that in clinical supervision, there isn't always a problem. There may be a capacity that you want to support or the person wants to develop. The supervisee may have a capacity that they want to develop. And I'll give a concrete example. Let's say the supervisee comes to Dr. Holly and says, Dr. Holly, since we talked last, I went to this brief online training about motivational interviewing, and that's an evidence-based practice that I'd really like to learn more about. The supervisee comes to the supervision and says, hey, this is a capacity that I want to grow. And that can become part of a professional development plan. It could also work the other way. Dr. Holly may make a decision, I think it might be a good idea if all of the clinical team had X number of exposure to cognitive behavioral therapy. And that may be a goal that's determined. And that can become part of the professional development plan. So I just want to underline, it's about building a capacity. It's not always about solving a problem. But Lourdes's parallel with the treatment plan is right on the money. And it's probably one that we're all very familiar with because we understand the idea of a treatment plan. But in clinical supervision, it isn't always a problem.
Oh.
Mr. Paul, I have a quick question. I don't know.
Go ahead, Tricia. Welcome back.
I don't know if it was asked when I left the room for the bathroom.
It's okay. If it was.
Quick question. So how long is it expected to be? Like, is it supposed to be as a treatment plan and that long, this professional development plan? How long is the expectation?
Understood. So I love it. Tricia, you're taking me back to when I was in school, and we'd say to our teacher, how many pages does this paper have to be? I don't know if anybody ever had that experience.
It seems like it's a lot. So that's why I'm asking,
It's actually not, and I'm about to relieve your anxiety about it, hopefully, because I'm gonna show you the form, which again, you know, you're only identifying a couple of different capacities that you're going to actually be addressing. So so I love your question, but before I show you the form, and I promise you I am going to show it to you. Before I show you the form, I want to touch back on something that Eunice said, because Eunice, the way you made the statements that you made were very powerful, and they were very powerful in the sense that you identified two key hallmarks of top-notch, superior clinical supervision. And I want to underline them because Eunice articulated them so beautifully. And Eunice, the way you said it, because you told us kind of through your own personal experience, but I want to underline them as supervisory capacities. One of them is the openness and the ability to collaborate with your supervisees. That you're actually collaborating with your supervisee. Yes, you're guiding them. Yes, you are the supervisor, and you can position yourself, and I'm thinking of Dr. Holly as I say this, you can position yourself to be a collaborator in the process, in the supervisory conversation. You can position yourself to be a collaborator. And I love the way you articulated that, Eunice. I thought it was so clear. The other thing, which is part of the collaboration, and people are not going to be surprised when I underline this, Eunice, I don't think, is Eunice also said, giving the supervisee a voice, letting the supervisee have a voice in the supervision. It's very powerful. Successful supervisors invite and make space for the voice of their supervisees. And, you know, Eunice, I loved your story because you framed it as like, you know, I used to be kind of afraid of my supervisor, and then I learned I had a voice in it. And hopefully what you will bring to clinical supervision is creating an opportunity for that supervisee to also have a voice. So I just wanted to underline that. I didn't want that to get lost in sort of the mechanical details and numbers of pages of the professional development plan. So drum roll, please. I'm going to share my screen. Exactly. I'm going to share my screen and show you the professional development form that you will all complete as a way to complete this time that we have together. And again, I'm just showing this to you because I just want you to have a heads up about it now, and you can be thinking about it now. All right, so hold on a second. Let me just get it. I have it right here on my desktop. And again, folks, we're going to walk through this together, and everyone will have the opportunity, and I do like to frame it that way. Everyone will have the opportunity to complete this. Excellent. And once we go over this form, I'm gonna suggest that we take a break, and then we'll come back and we'll start to bring our conversation for today. I don't know if you're aware of it, but it's already almost 1:30. So I just want to be very aware of the time, because I know that we need to stop promptly at 3 p.m. today. And I'm very much looking forward to our next time together. So just type in the chat, folks. Just type a Y in the chat if you're able to see the professional development plan. You'll see it up here. And I've heard from 15 people so far. Yes. So it looks like people are able to see it. Now, we're going to just slowly walk through this form. This is a form that everybody's going to complete. So the staff person's name, and again, we're protecting people's confidentiality. If you're using a real person, you would just want to put their first name and their last initial, your name, and then the date that you're working on it. Now, foundational practice dimension and element, we're going to get to that. Don't worry about that right now. You'll see competency to be addressed and page number from TAP 21. So you're going to identify a particular capacity in TAP 21, and you will note that capacity and the page. That's what's going to be addressed in this professional development plan. Okay, so remember, TAP 21, everybody needs access to TAP 21 by the next time we meet. Okay, and I know some people have access to it already. You would want to fill in here this narrative of what are the strengths of this particular supervisee. And they may relate to the capacity to be developed, or they may not. But you're giving an overall assessment of what are the person's strengths. What are the challenges or concerns? And again, as they relate to the capacity that's being developed, or just generally speaking, what are the capacities, the challenges, or the concerns? Okay, with this particular supervisee. Now, present level of proficiency from rating forms, level of proficiency to be achieved with this learning plan. Don't worry about that right now. We'll talk about that in more detail. Don't worry about it. Target date to complete the plan. Okay, so again, you're going to estimate as the supervisor how long you think it'll take for this particular person to move forward with this particular plan. Okay, now the meat of it, the knowledge, skills, and attitude. This is based on the capacity that you identified, which is in TAP 21. So what is the issue to be addressed that relates to knowledge, skill, or attitudes? Okay, the way that the TAP is broken down is looking at these particular areas based on capacities. Okay, so you'll identify what's the goal to be achieved. Notice it says measurable behavior, activities necessary to achieve the goal. So what will be the things that will be done to improve this person's knowledge about whatever the capacity is, their skill or their attitudes, and then how will the progress be measured, and what's the target completion date? Okay. Then if there are any additional comments about the plan, your signature, the counselor's signature, which again, we would leave blank because you're not necessarily sharing this with anybody, date for reobservation to assess performance, and result, that you would leave blank as well. Okay. Now, again, I'm just going to remind you, you're going to be identifying a particular capacity in TAP 21. Don't worry about these other things yet. You're going to identify the strength, the challenges. Don't worry about proficiency levels yet. With that capacity, there's knowledge, skills, and attitudes that'll make more sense when you look a little more deeply at TAP 21. And that's basically the plan. Now, I'm going to stop sharing my screen, and I'm just going to ask, and you can use the chat, will you be sharing the template, or will we have to build our own? we will share the template. There's no reason for you have to build your own. It's a basic form. Everybody will get a copy of the form. Great question. Thank you for asking it. Everybody will get a copy of the form, but do not worry. You don't need a copy of the form at this particular point. Now I'm just going to ask, and this is subjective. This is an opportunity for you to check in with yourself. And I'm going to ask all 27 of you to subjectively assess for yourself. On a scale of 1 to 10. Oh, well, Alexine, you've anticipated my question. So you're ready for this. On a scale of 1 to 10, 1 being, I don't feel any anxiety about doing this plan at all now, or 10, I feel, after looking at that, I feel over the top anxiety. Where would you put your anxiety level? 1 is you don't feel any, 10 is you feel over the top anxiety. So we have a 10, we have some 1s, we have some 2s and 3s, 4s, and let's hear from everybody. 7, 0, excellent. 0 can be part of the scale. Excellent. Some 5, some 2, excellent. Okay. Folks, this is a process. We're all in this learning community together. And what I want to assure you is everything that we do is going to help prepare you to complete this assignment. And you will do what you can do by the end of this particular learning community conversation. So I don't want you to start the plan. I don't want you to think any more about it until it comes up in further conversation. I just wanted you to know that that's what everybody's going to be responsible for. That form will be shared with everybody. Thank you, Dr. Holly. And we will all work together and have time to focus on this together to complete it. Okay? It's simply a way to give a structure to help you to move forward in using this particular method of supporting clinical supervision. Okay? All right. So having said that, folks, we are at 1:34. And what I'm going to suggest that we do, first, let me say thank you for your attention and your focus on everything that we've talked about so far. And what I'm going to ask you to do at this particular point is take a full 15-minute break. Be back promptly in 15 minutes, and we will move forward and we will continue our conversation. So have an excellent 15-minute break. Don't log out. You can just turn your camera off or walk away from your camera, and we'll see you in 15 minutes. Thanks so much, everybody. See you in 15. All right, welcome back. I hope you had a good 15-minute break. I had a little snack and I got to pet my dog. I hope you had as fulfilling a break as I did. We will go on from here. Well, actually, before we move on, I just want to ask, does anybody have any question or comment they'd like to make about the professional development plan or the professional development plan form that we just briefly touched on? Any comments? Yes. Yeah, go ahead, Lourdes, please. Go ahead.
Okay, sure. As during the break, I thought about it. I don't experience it in my real life. I've got a lot of supervisors, several of them, but I mean, haven't done that. So in real supervisors relationship, how many, say for example, we already identify the capacity of this person. More of them are strength-based, they are coming, they're interested to work, coming on time, respectful, all those kind of stuff. But he's lacking like interpersonal skills. Okay. Communication skills, writing skills. Yep. So my question, I guess, becomes how many of this form or how many can we tackle as a task during the time of this, I don't know, 1 year, 6 months, I'm not sure. So
Mhm.
that's my question. Is it ethical or it's good efficacy to do a couple of them, three of them, or just one? I mean, in real scenario. That's my question.
Yeah. And before I answer the specifics of your question, I really do want to underline a broader question that you're posing, which I think is a fantastic one. And I'm really glad that you're posing this question, because you're sort of drawing a very interesting distinction between real supervision and supervision as it's discussed in this course. And I love that, because my hope, folks, is that this is what's going to happen. That this professional development plan, the use of TAP 21, are tools that can be integrated into real supervision, not textbook or ideal supervision, into real supervision. So, Lourdes, I love the fact that you asked that question. And I mean, that's not really the question you asked. The question you asked is kind of how many capacities can we really address or tackle at any given time? And I think that is a case by case basis, because ultimately what you're asking yourself as a supervisor is what are the capacities required in order to do this job? What capacities does the person already have? What are the capacities that they need to develop? And of the ones that they need to develop, what are our thoughts about what are the ones that need to be developed first? What's the priority? And, I'm thinking of a couple of folks, as I say, that I would hope that a supervisor might say to me something to the effect of, and I'm just imagining this, okay? But I'm imagining I might hope that a supervisor might say to me, I had the opportunity to observe your work, and these are the strengths that I identified. And my hope is that the supervisor would be specific and identify those strengths. And I noticed some areas of professional development. I'm wondering if we can have a discussion about those areas, and I'd like to get your take on where we might want to start in regard to this. So my hope is that a supervisor would be engaging with the supervisee to identify the capacities or the areas for growth, and then invite, because I was thinking of the great client-centered example that Dr. Holly gave us before the break, which was hopefully a supervisee, and to Eunice's point, is inviting the supervisee to share their perspective on the areas or the area that they want to focus on that would help them in their work first. Go ahead, Zachary. What would you like to add?
Yeah, so I had a question that was also about like the competencies.
Yeah.
I can remember, I had a supervisor once that started using the TAP 21, and it didn't go well. It didn't go well, I think, for any of the supervisors. But essentially, what she did was like she gave us a copy and said like, look through this, choose one that you want to work on, and we'll come up with a plan. And I was wondering, like, is that a typical way that supervisors will have it was like and I think an attempt to be collaborative, but it was like too collaborative in the sense like just pick one that you think you could use. I wonder if like how much is prescriptive and how much is working with the supervisee. I'd imagine it's probably the answer is it's a continuum. But I'm wondering if like there's any like, rule rules of thumb on that. Yeah.
Well, what I'm gonna underline in terms of what you said, Zachary, and I love that. The answer, it's a continuum. But I love what you said, because you really kind of showed us your hand. You tipped your cards when you said that this is the way the supervisor did it, and it was disastrous, or it didn't. Maybe you didn't use that word, but you said that it didn't work out so well. And I'm wondering if you can say a little bit about why you think that approach didn't work so well.
So I think it didn't work well because the TAP 21 obviously is, it's a relatively, thick, like chunk of papers.
Yep.
And, it was sort of handed to us, and, we were asked to look through it, and we just didn't, it wasn't explained to us. I think she was new to the, to the TAP stuff. So she didn't have like a lot of knowledge about it, and I think it wasn't explained well. And I think, me and my coworkers, we saw this document and saw our, our clinical duties, and thought to ourselves, like, all right, I'll just pick something. Like we didn't take the time to really understand it.
Yes, and I think that's probably a pretty tall order to expect, that a supervisee, yes, you want to get the supervisee's perspective, but is it really their responsibility to digest the TAP and then come back to you and say, well, I've identified capacity number 72, and I think the thing that I need to do is that I'm Zachary, you didn't say this, but would it be fair to say that after the supervisor used the tool in that way, it kind of all fell by the wayside and nothing kind of went forward? Am I imagining correctly there, or was it a smashing success?
You would be correct to say that I think we did a plan. I remember we used that form that we just reviewed.
Yeah.
But I think it just sat in the employee file, and I think after it was done, we said, well, we did it, and we never really went back to it, unfortunately.
Right. And thank you for sharing that, because folks, it's not the tool, it's how the tool is used. And the fact is if it's not meaningful, if it doesn't support the professional development, then maybe it's not. Our hope is that real supervision and what can be effective supervisory practice will come together. You will need to make the determination as to how you use this tool, how you use the professional development plan with supervisees. What we can honestly say from the perspective of this particular course is that having a professional development plan that's actually collaborative and meaningful to everybody can actually help build capacities. If it becomes kind of an empty exercise in paperwork, it kind of goes the route that Zachary just described, which is we did it, and it stays in the file.
Yeah.
Go ahead, Tricia. Go ahead.
Oh, I'm sorry. I forgot. I just unmuted. No, I was going to say that I know the first time that I was exposed to the TAP, that it was just dropped in front of me, and I just like my supervisor was just read it. Read what? What am I reading? I had no sense of direction. I didn't know what I was doing.
Right.
And then she's like, and then we're just going to talk about some key components, and we'll put it on the list for your plan.
Right.
And I was just like, I just didn't feel like I got anything out of it, and it just became like redundant to me. Instead of, I kind of feel like she was using it as a Bible instead of using it as a roadmap.
Wow.
So I don't know.
Can I share something too?
Please.
I said, one thing you have to say, they dropped this information loaded on your lap along with everything else that you had in place too. So you got to remember that. You was already overloaded, and then here you come with the TAPS, and it has 238 pages, and the print is pretty tiny. So it's a matter of who wants to have to learn all of this along with everything else that you have sitting in front of you, right?
And you know, Eunice, as you were saying that, go ahead, Zachary. I was noticing Zachary having a reaction to what you said, and I think he's going to say something about it. But go ahead, Zachary.
So I think, sort of what I'm hearing is, as a supervisor, it's sort of our, it's our kind of like responsibility. It's our responsibility to know the TAP and kind of be able to say like, okay, if my supervisee is having a problem with, I was just flipping through right now. So I've actually through, some battlefield promotions, I am doing a lot of supervision all of a sudden. And, if I'm having someone who's like not filling out assessment paperwork correctly, I would have to like look through the TAP, say, hey, we've been struggling with this. Here's, one that we should work on. And maybe it's more, I think it sounds like it's more up to us. It might be somewhat prescriptive in like, we've been talking about this. Here's the, what would be the word, the competency that we should be, talking about, and then come up with a plan around it. Yes, no, maybe so.
Yes, completely. No, maybe, no, so. Yes, and let me identify something here, because as Zachary was speaking, an image came into my head, a picture, and the picture was an anchor. And what I mean by that is that the capacity that's identified in the TAP, the competency, that's the right word, the competency that's identified is simply a guidepost. It's an anchor and a guidepost for the supervision and the plan that's created out of it. We're not necessarily teaching to the book is the tool. It is not the Bible. It's simply it's a roadmap. It's a map. It's not a Bible. Okay. It's an anchor. Go ahead, please. Go ahead, Deborah.
Got to ask a question. So, and I don't want to sound stupid or nothing, but so every supervisor should have a personal development plan for this, for their super.
Let me throw this out this way, Deborah, because again, I appreciate the spirit of your question, which is you're asking about what is ideal supervision. And I'll put out, to be very clear and honest with you, as a supervisee, I've probably only worked with one supervisor that we ever co-developed a professional development plan. And what I can say is with that supervisor, because it was that supervisor, it was a really great process. It was helpful because we did it together. I got to help shape what I was going to focus on. And it was a wonderful tool that helped me to identify when I had reached a particular capacity. That's happened once in my career. Okay? Once. So to Deborah's question, should every supervisor have a professional development plan for every supervisee? Well, if it's a meaningful, collaboratively developed plan that helps that person with their professional development, yes. Is that realistic? Is that necessarily going to happen in every situation? read Trisha's lips. No. What we're saying here and why we're in this learning community conversation is because you want to be able to have the skill to do it. You want to be able to have the tools to effectively put a professional development plan together when it's warranted with that supervisee. So we are asking you and inviting you to learn a very technical skill that you may choose to apply in some situations and you may not. Ideally, though, if you had the time, you had the resources, ideally, you'd have a meaningful and collaboratively developed professional development plan for everyone that you had the opportunity to supervise. Ideally, Deborah.
Okay, well, I'm going to ask, and I I have my limited permit to practice for mental health counseling, and I do have a supervisor, and I'm going to ask her, do she have a professional development plan for me? Because I mean, she never introduced it to me. We never spoke about it, anything, but I'm going to ask her if she have one. And if she says no, then I'm going to ask her to develop one.
Okay.
And that makes sense?
My hope would be that she would not drop tab 21 on your desk and say, pick one. And because that would not be, hopefully you and she would develop your professional development plan together.
Together. Okay. I'm going to ask her today. All right.
Okay. Well, and again, I think Juan is making a comment here, and Dr. Holly agrees. And I'm wondering if, Juan, what you were saying is be careful what you ask for.
Not only that, but it also depends on your relationship with the supervisor. You know, the supervisor may not be at a level or be at a professional, emotional position to ask what she's, you know, she might take that as a challenge, you know, so just be mindful.
Right. Exactly.
Okay.
Dr. Holly,
Okay.
please jump in.
I just want to further Juan's point. I was coming from the mind frame of, can this person develop what it is that you're looking for in them as a supervisor? So for example, if you're saying, okay, you know, as a clinician, I could use a little bit more more MI in my, you know, my toolbox, or I could use a little bit more help around how I do my, I don't know if you call them DAP notes in New York, but my progress notes. So I encourage you to first figure out what it is that you need from that clinical supervisor. And then back to Juan's point, can that person actually provide that for you? Because I think we all can have at least one story where people get promoted and not necessarily should be promoted as supervisors, right?
True.
Yes.
So before you give her that task, I would encourage you to at least identify maybe one or three things that you would like to have professionally developed, because it is professional development plan, and then talking with them, because if she or he don't have the skills, you're really just back at ground zero.
Yep.
Okay.
Yep. Yeah. And I think General Zachary Battlefield Promotions wants to say something to us in regard. Go ahead, Zachary, please.
So I could say, you know, like I was promoted, you know, we had, you know, a supervisor leave, and, you know, so I was the senior counselor, then I was the acting program manager, you know, so then I was back to senior counselor. Now I'm back to acting program manager. And that time, you know, I'm like, I have this massive caseload, you know, we're dealing with all these, you know, so I think that one of the things that, you know, that I've been waiting for this, like I hope I've done good supervision, but I know I wasn't doing like great supervision, because I didn't, like, I think probably a lot of people that end up in supervisory roles don't end up like, I think my agency policy is like, this has to happen before you end up as a supervisor.
Yep.
Meantime, you know,
wing it.
Is what it is.
Yeah.
It's more like, we learned about the, peer supervision or consultation,
Yep. Yep.
So it's, sometimes they might not have the skills just yet.
Correct. And Charles, I really love your question in the chat, and I'm going to respond to it. But I want to throw something out here in terms of what Zachary said, and I'm going to just ask this question rhetorically. You don't need to respond to this, but how many of you, and you can ask yourself, you can this is rhetorical. You're just asking yourself, how much training, if you're currently a supervisor, how much training did you get as a supervisor prior to being in this course? And yeah, Zach is not saying okay, he's saying 0. Okay. Sure. And again, it's rhetorical. And Deborah is also saying 0. So thank you for disclosing. That's great. I'm not asking people to necessarily do that. To Zach's point, people often are put in a supervisory position. They're promoted into a supervisory position, and they have not been given the tools that they need in order to do that. So I just want to be very clear that, and Juliana says, I was once trained by going over audit thresholds for 16 hours. Okay. So again, that's partly why New York State, and maybe other states too, but New York State in particular, has made it mandatory that people who are going to be supervisors must complete Clinical Foundations I and II and the assignment, so that there's some standard of clinical supervision. Now, I want to address what Charles put in the chat, because I think it raises a really great point. And then I want to come back to something that Deborah said. Charles writes in the chat, would you say that a level 1 counselor should have a professional development plan versus, and if I'm understanding you properly, versus a level 3 counselor may need one as it is mutually agreed upon? Now, Charles, what I think you're getting at here, and tell me if I'm understanding you correctly, is that a level 1 counselor is developing more basic competencies, and a level 3 counselor, hopefully as a result of their experience, they might be able to be more collaboratively involved in their professional development plan because they have greater experience and they may have some of these foundational capacities already. Is that what I got it. So I'm understanding that was okay, not 0. Okay. So I would throw out, just for consideration, that collaboration is a possibility in both scenarios. And I would say that perhaps a counselor with greater experience may have deeper insight, may not, but may have deeper insight into what they may need for their professional development. So they may be able to come to the table and say, Charles, having done this work for 25 years, the area that I really feel that could be a growth opportunity for me is this. And can we develop, can you as my supervisor, can you work with me to develop that particular capacity? Can you help me to develop that? So Charles, any thoughts or any reactions to my response to your question?
No, I think you are dead on. And in my experience, level 1 counselors may not have that level of awareness yet. And there's so many things you can, avenues you can explore, and you have to prioritize what is most important, right?
Right. So Lord is the question. You do have to prioritize what's most important. Yeah.
Right. And because their skills are basic, some are more advanced than others, but I think in general, it is the hope that a level 3 counselor have that more awareness, just as you mentioned. Yeah. So I also had a level 1 counselors who may think, I don't need any more work.
Yes.
I am great, you know.
Yes.
And
Yes.
if,
Sure.
you know, that may not be as collaborative as you would like, because all of us have things to grow and to work on in our field. So you know, it varies.
Yes. And Charles, what you're really identifying, which is critical, is really the art of clinical supervision. Because there are times, folks, when, as the clinical supervisor, there may not be agreement from the supervisee about what the capacity is or what the focus is. And as the clinical supervisor, you know, we need to be able to articulate why we've determined this is and it's not as simple as just saying, well, I'm the supervisor, I say so. That's because, you know, that sounds like what daddy or mommy or caregiver says when they don't, you know. Clinical supervision is a conversation between hopefully two collaborative partners. And we may need to answer somebody's question. If I'm the supervisee and I say to Charles, how could you think I need more training in motivational interviewing? I'm an expert in that. And Charles, as the supervisor, might need to give his rationale. And we might need to talk through that. Dr. Holly, please, the floor is yours.
I'm glad you brought up about a supervisee may not necessarily agreeing with you, because I have had experiences where they won't sign off on a professional development plan because they don't agree with your observation.
Yep.
They may not quite get it, may not understand it. You have people who've been doing it for years, so they feel like you don't know, but you do actually know, because that's why you're a supervisor. And not by default. I'm just saying there are supervisors who really just have no clue, and they have to be a body in place. But for those of us who actually do know and do the work, the observations, and say, okay, hey, this is what you could use to strengthen your counseling, your therapy tools, there will be some kickback. And I've had it. I don't know about anybody else, from supervisees who will not agree with that professional development plan. And how dare you?
Yep.
And so even though you may come from, or I have come from, a collaborative spirit, that it can turn combative if that person again just disagrees with, you know, your observation. And it could get a little wonky.
It certainly can. Supervision is not easy. It's not easy. It is skill. It requires skill, and so many skills together. Now, before I show my slides again, I want to go back to something that Deborah said, because Juan and Dr. Holly really wanted to caution Deborah about how she proceeds with her supervisor around, like, so what's the professional development plan you've got for me? And if you don't have one, I want one. So, and I get it. So Deborah, if it's okay with you, can you and I engage in a little conversation? Would that be okay? It'll be all right? Okay.
Yes, for sure.
Okay. Fantastic. So if I had the privilege of supervising Deborah, and I was engaging in a supervisory conversation with her, and I wanted to get a sense from her about what her thoughts were about her professional development, I'm going to suggest that we take just a couple of moments, and I'm going to try and demonstrate how I might navigate that conversation. Now, let me make something very clear. How I statements, I'm following the guidelines too, how I might navigate this conversation. And all I'm going to ask you to do is, in this brief little conversation that I'm going to have with Deborah, is I want you to just observe me, quote unquote, in the role of the supervisor. And I'm going to ask you to identify or react to the conversation. Now, Deborah, can you please confirm for everybody that we have not met and prepared this beforehand, and that this is just you and me talking?
Yes, this is just me and you talking. We did meet yesterday, but no, I'm just kidding. And I'm just no, just kidding. No, we have never met before, and this is just us talking.
I knew I picked the right person to have this conversation with. So, Deborah, I really appreciate you being open to having this conversation. And, you know, during the course of our learning community, you've expressed a real interest in wanting to have a professional development plan. And I'm wondering if it would be okay if I asked you a question.
Yes.
So when you think about your work and what you bring to your work, what do you identify as your strengths, as the positive and beneficial things that you bring to your work?
And my passion for the work that I do.
Mm-hmm.
And that's I guess that's it, really, my passion. But because my passion for my work is so strong, it keeps me directly with my clients, like hands-on. I'm a hands-on person.
Mm-hmm.
So and sometimes I think I'm too hands-on.
Okay.
You know.
Overall, though, the deep passion that you feel for the work causes you to have very strong kind of hands-on working relationships with your clients, and ultimately,
Yes.
that's a very positive thing.
Okay.
Yeah. So I'm wondering, when you think about areas that you'd like to grow, what do you see as sort of areas of professional development for yourself?
Well, my time management.
Okay.
My time management skills not even sometimes are off a lot. Sometimes it's very hard for me to stay focused on one thing, and I'll start one thing, do something else, and at the end of the day, everything is halfway done. I didn't complete anything.
Okay.
Also, my writing skills.
Okay. So you've identified 3 very specific growth opportunities: time management, focus, and kind of completing a task before moving to the next task. And I'm sorry, please remind me of the third one.
What I said? Writing skills.
Yes, your writing skills. When you think of those 3, the time management, the focus, and the writing skills, which one of those is the highest priority for you? Which one of those is the one that you'd really like to focus on and collaboratively develop a plan with me to help you accomplish?
I think it would be my time management, because if I could stay focused more on my time management, then my notes would get done in a more in a better capacity. So it'd give me more time to write and reread and reread, you know, to give me more time to go back and reread them, and so I could catch my own mistakes. Because sometimes if I can't spell, like I might want to spell, say a big word, Manhattan, and I can't say, if I don't know how to spell Manhattan, instead of me taking the time to find out how to spell it, I'll say city. So it decreases my level of writing, and this is something that I know. So I think my time management skills will help me in all them different areas.
Excellent. So yeah, you've given it a lot of thought, and you can see that prioritizing time management would really help you to grow in these other areas too. So time management is really the place to start for you.
Yes, I think so.
Okay, so before I offer any suggestions,
does that make sense?
Yes, it makes complete sense to me. And again, you've given it a tremendous amount of thought, and you can see the relationship between the time management, the focus and completing tasks, and how that would even play out in supporting your improvement in your writing skills. So it makes tremendous sense to me. And I guess I'm wondering, as you think about this particular professional development goal of time management, what are your thoughts about what might be a next step for us collaboratively how can we work together? What's your thought about how we can work together to support you in the process of time management?
I don't know. So I'm giving that back to you as my supervisor. Like, I don't know what are your thoughts on it? Like, what do you think as my supervisor that we can do collaboratively to help me in the steps?
Excellent. So you're open to the idea of me maybe giving it some thought and making a suggestion about a way to begin.
Yes, because I have no clue. I don't know. I don't know
Fantastic.
how to start, where to start at.
Well, actually, I think we have started because you've identified the area that you want to focus on. So,
Okay.
and time management is it. And I'll give it some thought and I will come back to you with a couple of suggestions that we can just use as a starting place for the conversation. And I can see what your thoughts or your reactions are to that. How does that sound to you?
That sounds good. That sounds great.
Okay.
It gives me something to look forward to. Yes.
Well, I look forward to it as well.
Okay.
Okay. All right. So let's
Thanks.
pause. Let's pause right there. Okay. So any thoughts, any reactions to the supervisor, to what the supervisor did and was doing? And then we're going to come to Deborah as well. But I want to open it up to the learning community. Any thoughts or yeah, go ahead, Dr. Holly. You can start us off.
Well, I mean, although it was a role play, I think you did very well, again, showing a very person-centered approach, and you made it very welcoming for it to be a collaboration. I don't know her present supervisors, so I don't know if they would be as welcoming as warm, and I don't know if if they have time management skills that they could lend to give her tips or to help Deborah. So that's a concern for me, but all she can do is just ask and hope for the best. But I think your role play with her was great. I loved how Deborah, oh, you said about you. Yeah,
Yeah.
you just set the stage for her to just be really honest and open and vulnerable.
Okay, Dr. Holly, before we go to Juan and then to Lourdes, can I ask you one quick follow-up question?
Sure.
So if you could isolate one skill as a supervisor that you thought that I employed in the conversation with Deborah in order to make it person-centered or collaborative, if there's one skill that you could isolate that you observed that I brought to it, is there anything in particular you'd identify?
Hell yeah, you did some MI in there. You paraphrased and rephrased what you thought you heard and made sure that she understood, make sure that you understood what it is that you thought that you heard and were processing in order for you to effectively help her.
Okay, thank you so much, Dr. Holly. Thanks for elaborating. Juan, the floor is yours, and then we're going to go to Lourdes, and then maybe we'll hear from two other people. Go ahead.
What I appreciated from the interaction, specifically yours, was how you were able to disarm her, and by saying, "Hey, what are your thoughts about this? How do you feel? Or may I ask?" So you made her feel at ease, where it's where she, if she were to, she wasn't resistant or combative, because you were making her part of the process.
Okay, thank you so much, Juan. Thank you, Lourdes. The floor is yours.
Well, quickly, Doctor already said the skill, which I've heard a lot, is the MI. But I guess you're very good in narrowing it down, which my question a while ago when we opened up the second session, to the priority. So it's kind of a focus and not so scattered with a lot of skills that we can even do at one time. Right. So then when you narrow it down to time management, which the supervisor already acknowledged that with that, she justified that it could happen, it could work that way. I appreciate that, because that answers a lot of my, the question that I have. How many of this development plan we should do in a sitting? And it's look like it's a lot of them. So this is important. And thank you so much. MI actually is the skills. You're very good. I like it.
Thank you.
I do that a lot too. I know, and not a lot, but it helps. Thank you.
You're welcome. Thank you so much. Alexine writes, you also made clarifying statements. Okay. And Charles writes, like your affirmations and confirmation of the identified issue, also liked that you did not feel compelled to give an answer in the moment, but asked to think about some suggestions and kept it collaborative. Yeah, I appreciate you noticing that Charles, that I didn't offer a suggestion in the moment, because it is something that I actually wanted to be thoughtful about, as opposed to Brittany Davis writes, I also liked how he, I guess me, opened it up more for them both to think on it more. Yeah, that we didn't have to rush to a solution at this particular point. Yeah. Now, Deborah, I just want to ask before we move forward, as we start to bring our first session to a conclusion today, I just wanted to ask you, what was that experience like for you? What was your experience of our conversation?
Well, you made me feel very comfortable with being able to express what I felt my issues was. Like, you made me relax. You put me into like a relaxing state where I was able to just explain to you what I felt my issues was. You wasn't like, some supervisors be like, okay, so what do you think your problem is? And, really tight and, upright like that. But you more or less came down to the level where I was at, and more or less and talked to me like I was on your level, versus you being here and me being here. You really made me feel like, we was sort of kind of equal. So I thank you for that.
You're welcome. It was a pleasure to talk to you. I'm wondering if I could ask you one brief follow-up question.
Yes.
So you mentioned that I made you feel comfortable.
Mm-hmm.
And I'm wondering, what did I do? How did I do that?
You more or less, you let me know that you expressed to me that you was listening to what I was saying. Your listening skills was very straightforward. It gave a relaxing, a really relaxing aura, versus like whatever I said, you responded to it. Like, let me know, okay, I hear what you're saying. What do you think that how do you feel you think I can help you, or what do you think we can do together, as a team to move forward? So that's how you make me feel comfortable. You let me know, like, hey, I'm here for you, and whatever the problem is, we can develop something to work together. So you didn't just say, okay, well, I'll put some stuff together and come back and then we'll work on it. No, you didn't do that. You asked me, what did I feel that we can do together to work on the issue? So that was the balancing moment.
Thank you. Thanks for elaborating on that, Deborah. I really appreciate it.
Mm-hmm.
So based on what Deborah said, folks, the thing I really want to underline, that's one of the, and Eunice, I'm thinking of you as I say this. Another hallmark of really effective supervision is that you create an experience where the supervisee feels heard, and that the supervisee knows that you're trying to understand their perspective. You're trying to see it from their perspective. Okay. And Mazel writes, there was no superiority.
Yes, that's true.
Deborah agrees with that. Yeah. C. Sawyer says, I like that you created an environment that she felt comfortable expressing concerns. And again, I'm glad that that happened. And the thing I want you to know, folks, is that as the supervisor, we have the capacity to create that environment. And it has everything to do with how we engage with the person. Okay? Go
Can
ahead,
I
Eunice.
just share?
Yeah.
I was going to say, in this community, you allowed her to feel safe opening up amongst us all. You gave her the safety. She felt safe. And although we're all sitting here, she was comfortable enough to share that in the community.
Yeah, thank you, Eunice. And it's important to acknowledge that, because Deborah really did take a risk to talk with us about what she sees as her strengths and what she sees as her growth opportunities. And, you know, it was not lost on me that Deborah really identifies. And Deborah, I'm not surprised, having met you and being able to interact with you in this conversation so far today, is that you're very passionate about your work, and that passion builds trust and relationships with your clients. That I'm not surprised by that at all.
Okay.
Yeah. And Charles writes, I like the therapeutic alliance with a counselor client building the supervisory a lot. Exactly. And again, Charles, another great way to think about that parallel process, because we are building that supervisory alliance. Words have meaning. Loved how you use the phrase challenging and opportunities. Yeah, thank you, Alexine. Agreed. So folks, I'm going to share my screen. We're going to just review a couple of things, and then there's something I'm going to ask you to be thinking about until we see each other next. And then I do want to provide an opportunity for folks to offer any reflections, reactions, or questions about our first 3 hours together. Okay, so let me just share my screen and review a couple of things, and then I'll lay out what I'd like you to be thinking about for next time, and then we'll have a little bit of opportunity for some reflections. So a couple of things to keep in mind about this particular course. Again, we've put on the table the idea of realistic supervision and a structure and a process of supervision that we're talking about in this particular learning community. And the hope is that there's a union between these two things, that you'll use these resources, these tools, and these practices in real life supervision when it's appropriate for you to do so. And again, as I said earlier, ideally speaking, we would want to have a meaningful and collaborative professional development plan for every person that we get to supervise. And let me make a clear distinction. That's not the same thing as me walking over to Christopher's desk and dropping tab 21 on his desk and saying, Christopher, read this, pick one, let's talk. That's not what we're suggesting here. So I don't want anybody to think that that's what we are hoping that you'll do with these tools. So keeping in mind this, and it was said earlier, I'll go back to that. It was said earlier that, you know, the supervisory alliance, the building of trust and building of a collaborative partnership with somebody is a relational issue. Supervision is being a supervisor is a relationship that you have with your supervisees. In order to give feedback about practice, oftentimes direct observation, being able to sit in on somebody's group, observe somebody's counseling session, having direct observation to be able to give specific feedback on strengths and opportunities for enhancement and for growth is ideal. Hopefully, supervision, one of the outcomes of supervision is that the counselors, the folks that we have the opportunity to supervise, that they feel a degree of self-efficacy, meaning that they feel like they can grow, they can accomplish a professional development goal in partnership with us. Also, that we want supervision to be solution-based and strengths-based. You may have noticed in the conversation, the little demonstration of the conversation, I started with, what are the strengths that you bring to your work? Now, had we had longer time and had we had a supervisor-supervisee relationship, after inviting the supervisee to talk about what strengths they think they bring to their work, I could then reflect on what strengths I observe that they bring to the work. Again, this needs-based approach, the idea that we are helping the person to prioritize what they want to focus on in terms of their professional development, and we're balancing that with what we as the supervisor may need, what capacity we may need them to address. And again, we're looking for a fair balance between those two. Outcome-oriented, the fact that supervision isn't just talk. It requires actions, it requires reflection, and it requires assessment. Sometimes part of the purpose of clinical supervision is to help people to adopt and refine their use of evidence-based practices, such as cognitive behavioral therapy, motivational therapy, so motivational interviewing. And then the last piece of it is that, and I'm thinking of Dr. Holly as I say this, is that we all ultimately will develop our own unique individual practice of supervision, and hopefully within our practice, we will be able to individualize the supervision that we offer each supervisee, meaning that we are trying to understand that unique individual, their strengths, and their particular growth opportunities. And we will be able to adjust ourselves in order to best engage that particular supervisee. We'll all have our own unique model of supervision, and we also want to keep in mind that we need to be flexible enough that we can individualize how we respond to each supervisee. So this particular course, as we've already said, is going to focus on these 7 domains. Some of these we're going to focus on more intently than others. And it's just important to keep in mind that, like the first course, there are tons of resources associated with this course. Many of the things you may not touch. Number of them you may go back to and review after our conversation, and some of them may become very important to you. Also, just to recap and to remind you that we have this 12 hours together, and you will also, it's framed here as a homework assignment. I don't know if that's the best way to actually phrase it, but as you know, everybody will have the opportunity to develop and complete and submit a professional development plan. And we will be talking about that throughout our 12 hours together. We've been talking about it a great deal today. You've already looked at the form. And my hope is because we've discussed that, you will feel a bit less anxiety. Did somebody want to comment on something? No? Okay. So when we meet next time, folks, we are going to talk about terms and sort of roles a bit. I do have something very particular that I'd like you to focus on, though. And I want to acknowledge too, and if you can just let me know in the chat, does everybody have a copy, either in hard copy or electronically, of the participant workbook? If you have a copy, yeah, and some people have printed it out. Okay, if you have a copy of it, and if you don't have a copy of it yet, please get a copy. Yeah, Amber, please get a copy of it. And I don't know if my colleague Free Chapel is still with us, but if you are, Tree, if you can put a link so Evangeliste can get a copy of it too. But everybody needs a copy of the participant workbook. So please make sure, if you don't have a copy of that, please reach out to Tree Chapel via email, or maybe if Tree is still with us, she'll put the link in the chat. But if not, don't worry, just send her a quick email and just say, hey, can you send me either the document or can you send me the link for the document? Because everybody is going to need the participant workbook. You're going to need TAP 21 for next time, and you're going to need the participant workbook. Okay. Now, oh, wonderful, wonderful. Good, good, good. Glad you have it. I know there's probably a lot of documents that you have associated with this course, and sometimes it can be tricky keeping them all straight or in order. So glad you have it. Okay, good. So anybody, oh, wonderful. Thank you. And Juan, thanks so much. Juan has put the document actually into the chat, and you can click on that and upload it to your desktop, or you can drag it to your desktop, and you'll have it. So looking at that, there are some pages that I'm going to ask everybody to take a little bit of time to review. And basically, it's the pages about models of supervision. And I'm gonna bring it up on my desktop so I can tell you specifically what pages I want you to look at. So in the workbook, the pages I'd like you to look at, and just look them over, read them over, be prepared to have a discussion about them. And again, just read them over. Don't stress yourself out, but just read them over. Those particular pages start on page 17, page 18, 19, 20, 21, 22, 23. So I'd like you to look at pages 18 through 23. I'm going to ask everybody to type that into the chat. 18 through 23. Just
Okay,
type
so
that.
no 17.
Nope, you don't have to look at 17. Just 18 through 23. Okay, excellent. Thank you so much for typing that into the chat. So I'm just going to ask everybody to look those over, familiarize yourself. Yep, thanks, Eunice. Pages 18 through 23. I'm going to ask everybody to just familiarize yourself with those pages and remind you folks that we're all in the process of developing and refining our personal model of clinical supervision. No single one of us in this learning community would conduct a conversation with Deborah the same way that I would. Eunice would bring her uniqueness, just like Heather would bring her uniqueness. That's what you want. It doesn't mean that we may not share certain skills. We may not engage in a particular style, but we're all going to do it uniquely ourselves. Okay? So again, what I'm asking everybody to do in preparation for next time is review in the participant workbook, pages 18 through 23. That's the only thing I'm going to ask you to focus on. You don't need to think about the professional development plan. You don't need to think about TAP 21, but you do need to have TAP 21 and your participant workbook by our next conversation. Okay? One of our colleagues has noted, Juliana has mentioned that I may have misspoken, that it's page 17 through 23. So just to be clear, just to cover all our bases, let's start with page 17. So I'm adding a page there. It's 17 through 23. And thank you, Juliana. Thanks for noting that and for letting me know. Fantastic. So folks, what I'm going to ask everybody to do, well, first let me say this before I ask you to do anything. Thank you. Thank you for being in this learning community conversation. Thank you for bringing what you have brought to the table so far. I'm really looking forward to part 2. And what I'm going to ask everybody to do now is just take a nice deep breath and let it go. Great.
And come back to your point.
What was the point?
I just wrote down, come back to your point before 2
Right.
p.m.
And what was that point? You and a colleague were supposed to be bringing me back to this particular point. What was the point?
Was it me and Zeb or me and Juan?
Yes, I wrote it down. I'm trying to find out where I wrote it at.
I think is our takeaway from the course.
We are Evangelista. We are going to do that.
Okay.
Yeah, but do you want to start? What's a takeaway that you have from our time together so far today?
Oh, I shouldn't have done. Well, for me, one of the things I've learned, I was jotting down a few things like development and to improve my skills, and if I'm going to work with supervisee, for them to develop their knowledge, my role as a supervisor, and how I would implement the skills that I've learned, and how I would be able to understand weaknesses and strengths that supervisors may brought to the table, that I can able to assist them in navigating themselves back into the profession, to offer intervention to clients.
Fantastic. Thank you. You weren't prepared for that, were you?
Not really, but I thought
it just kind of came out.
Just listening and thinking what I would have done as a supervisor and what the skills I've gained. And really understand that the tip 21, when I saw it first, it was like just a bunch of words, very confusing.
Yes.
But starting when I've done the course in the first section of the course of 14 hours, it has prepared me to understand what the tip was offering and the different domains, and it really was helpful. But without that foundation, I would have just looked at it as a big book with tick words and everything, and unfamiliar jargons and everything. So I was really grateful that I was able to look at it. I've not looked at the tip 21A as yet.
Okay.
But the tip 21 is very useful.
Fantastic. Thank you. Yeah, Lourdes, go ahead. And then Deborah wants to remind me of what I'm supposed to comment on.
Well, quickly, this about the reflection, what I got.
Yeah.
Well, in May, this is like giving voices and faces to the number 1, the foundation 1. It's like the live with lively conversation. But just to tell you quickly who I am, I just graduated from my MSW actually last May. So what's going on with this? I'm not a supervisor, I already said that. I'm planning to get my KSAC and my MSW licensure. But what I've been thinking right now, if you want me, I'm not even thinking of being a supervisor. But I feel like this course makes it valuable to everybody to understand, because it look like when you do supervision, it's look like just to do it as mandatory thing. It's like because it has to be an hour or so. But with this, it clarifies the purpose, the value. What is it? What's the mission to the agency, to you, to the relationship, to the clients? It really so much so beautiful that I like.
Amen.
I like everybody. I mean, not anymore like I want to be a supervisor because you have I don't think so. If I could, sure, why not? But what I feel is the value of this, the time that we can move together in an agency, more productive time, so everybody could be productive in any way. That's all I want.
Thank you. Thank you so much. So folks, I am keenly aware of the time. I've stolen a minute from you, and I'm sorry about that. So Deborah and Dr. Holly are going to have to remind me of the point I have to come back to next time. So folks, thank you so much. And we will see you on Monday. Thank you so much, everybody. Please
Thank you.
and
Thank
be
you.
well, and I'll see
Yes.
you soon.
See you soon.
Bye-bye,
All right,
everybody.
Bye-bye.
thank you.
Thank you.